News Radio 680 WPTF, and you're listening to That Cancer Show. Thanks for being with us. It's a service of the Cornucopia Cancer Support Center in Durham, and I'm Scott Fitzgerald. My host here, the one who's really leading the charge, Mary Lawrence. Our guests are acupuncturist David Peters and communications executive Sharon Delaney McLeod.
So, David, for our listeners who are thinking about getting acupuncture, what should they look for in a practice or a practitioner?
It's really kind of a personal journey, what you want to get out of treatment. I have a training in lots of kind of other things than other acupuncturists might have training in. I teach meditation, Qigong, Tai Chi. I do nutrition, dietary therapy. I do herbal therapy. I do lots of different things. Mm-hmm. So not everybody's trained the same. So find out their training. Mm-hmm. And also, it's best to ask other patients. Ask the doctors that have had good results. Those sorts of things. Really, a warm referral from a friend is much better than looking up something on Google.
Mm-hmm. Sharon, if you had a friend or acquaintance ask you about acupuncture, what would you tell them to look for in a practitioner?
I will be honest, I've only ever been to David, mm-hmm. and I can't imagine going somewhere else. And part of that is because David knows my medical history. He's treated me for 10 years for other things. But mm-hmm. once again, any ailment I show up with, he is able to fix. Mm-hmm. So I think that there's definitely a relationship, just like you would with a long-term primary care doctor.
Yes.
Go and meet some acupuncturists. Maybe somebody is more comfortable with a female or a male. It just, that's up to your personal preference. Mm-hmm. But I think if you go and meet, and I'm sure that acupuncturists would be open to a consultation or a meet and greet before committing to doing a visit. You could also go to visit one and then go visit another and see which one you liked mm-hmm. better, or if you had a better result.
Right.
Well, because a lot of it, like you were saying before, is you need to be relaxed. You need to be comfortable. You need to allow your brain to say, it's okay for me to just let go here. And if you're with somebody who makes you feel bristly, then it's not going to work for you. You need to relate to somebody.
Sure. And I would have to imagine that. I know when I go to Long Life Wellness Center and I walk into David's treatment room, I take a deep breath and I can exhale all my troubles away, per se. Mm-hmm. And last week was a particularly tough day for me at work, and my mind was going 100 miles an hour, and I almost thought about not going to acupuncture, and boy, I'm sure glad I did, because it helped release so much stress and anxiety. In addition to fixing all the physical ailments, it really helped quiet my mind and make me feel more at ease with what was going on.
Very good. You went to a happy place, which is good. Now, you mentioned, David, dry needling. What is that? What is that, and what does the state law say about that versus acupuncture? Because I understand they're different, right?
Well, yes and no. They say that it's different using technical jargon, but it's really acupuncture. And it is a small subset of all of the complete comprehensive scope of acupuncture, but it still is acupuncture.
How did it get the name dry needling?
Well, it used to be wet needling.
Mm-hmm.
And so they used to use things like B12 injections, lidocaine, even just salt water into trigger points. And it came from a woman named Janet Travell was doing this work. And so one day she didn't have anything to put in the needle, so she used the hypodermic needle to put into the specific area and got a result mm-hmm. of actually getting the muscle to relax some. Mm-hmm. So that's actually where the term dry needling comes from.
Okay.
Yeah, but so since then, they have evolved into using the Class II medical device of the acupuncture needle, which is really for acupuncturists. And I'm paraphrasing here, but the AMA, American Medical Association, just came out with a position statement on dry needling, saying that really it should be left to medically trained doctors and acupuncturists.
And I'm sure you agree with that.
Yeah, I do. Yeah. It really, yes, you can get some result, but you really want to be safe about it too, because it's something that can cause harm, nerve damage, and in some cases collapse lungs, and can be fatal. Mm-hmm. There's also the question of professional drift. There are these other professions that want to do this, and they want to get a minimal amount of training, but they want to be able to do acupuncture. And then, the professional drift part is, okay, well, supposedly they're working on trigger points, but then they say, oh, well, I heard that this point is good for the lungs, or this point is good for this, or this point's good for that. Well, they start to go into territory that they don't know really what they're doing.
So I'm thinking massage therapists, physical therapists might think, gee, I could add this, put this in my quiver and expand.
That's right.
Is that where the drift is coming?
Well,
It is.
It sounds like it, and it's kind of something that's relevant for us at Cornucopia is that our licensed massage therapists all have special training in working with cancer patients, because of lymphedema and neuropathy and that sort of thing. And so you may not necessarily want to go and have a Swedish massage if you're a cancer patient, or a deep tissue massage if you're a cancer patient. It's a matter of relevance and good sense and precautions and
Absolutely.
experience.
Yeah, I totally agree. The more you know, the more you can handle the different complexities of the medical situations that you're going to see in front of you. Really what this whole dry needling thing is for specific trigger point, pain, right? But that's where quickly that drift can come in, where somebody can say, oh, well, I know how to do this, so then let's see if I can start addressing some of these other things.
Right.
And really, there's no kind of police out there that are going to be, looking over their shoulders. And, already they've been shot down by the Rules Review Commission, and they keep on doing it. So they're already displaying unethical behavior, and, so you wonder where it's going to go next.
Right. While I'm thinking about it, another side effect, if you will, or just a medical condition that sometimes goes hand in hand with cancer treatment is depression. And quite a few of Cornucopia's participants have really felt some improvement in their overall state of mind, and as a result of acupuncture specifically targeted for their depression or melancholy or that sort of thing.
Yeah, I think that depression, has a lot to do with how much energy is in the body, how well it's moving throughout the body. Also, dietary is very important. That's where all the serotonin is actually produced, is actually in the gut. And then how is it being delivered and telecommunicated, if you will, through the neurohormones and neurophysiology. So the activation of the brain that we talked about earlier, I think that's very important for all of that. And it helps to reboot, reset those types of things.
And I have to imagine that you see it all the time. As somebody whose mood gets elevated, they attack life differently, and become indomitable.
Right.
And Sharon, you were talking before. It's it. You're going to do it. You got it. You're going. So it's good to keep that up.
Whether you feel physically up to it or not, it's like, for you to continue working full time in your career, going through treatment, that's a huge feat. That's really impressive. So, David. So I would love for you to share with our listeners your contact information, how they can get hold of you, your practice, and also how they can learn more about your ambassadors program.
Absolutely. I'd love to share that. So you can get in touch with me at longlifewellnesscenter.com. And as far as the ambassador program, all of the information is on our other website. For that is ncaaom.org. And I'd just like to briefly mention that we have an upcoming walkathon that acupuncture ambassadors can walk with us around the legislative buildings downtown, October 29th. And you can find out more on our website, ncaaom.org.
Is there a link to that website on your website?
There is not.
You might want to put that there, because
that is a good idea.
Because there's a lot of letters there. I tried to write it down, and I think I might have messed it up.
So give us your practice website one more time.
My practice website is longlifewellnesscenter.com.
All right, Sharon Delaney McLeod, you're in the world of communications, and you help people get their message to other people. you got great messages to tell, and you tell great stories. So if somebody might want to reach out to you from a business standpoint, how do they do that?
Oh, well, thank you. Yes, my company is called Green Room Communications. It's a pretty simple, kind of long, but simple URL. Our website is visitthegreenroom.com.
Visit the Green Room. And the Green Room is the room off the side of the stage where people get ready to go on stage, right?
Exactly, because we're going to get you or your company or brand ready for the spotlight.
Wonderful.
Oh, I love it.
That is wonderful. Thank you both for being with us here today. You've been listening to That Cancer Show. Great one, too, about acupuncture. It's a service of the Cornucopia Cancer Support Center, and you can learn more about non-clinical cancer care on the website, cancersupportforyou.org.
And until next week, live life to the fullest.